So our next speaker is Mark Crawshaw. Mark is qualified in the Royal Veterinary College in London, and he is a specialist farm animal director of MBM Veterinary Group in Kilmarnock in Scotland. And he's going to talk to us about the failure to define the etiology of acute respiratory disease in 13 out of 15 live dairy cows in Scotland.
Okay, thank you, Sally. Acute respiratory disease in dairy cows, there appears to be very little published information on this subject compared to the condition in young cattle. However, what there is suggests that pneumonia in dairy cows is a significant problem. The Scottish Agricultural College, which delivers the disease surveillance programme that's government funded in Scotland through post-mortem examinations and laboratory sampling, examined a series of 327 dairy cow post-mortems that were carried out over a 3-year period. And pneumonia was the second commonest cause of death in these post-mortems after liver fluke. An example from the peer-reviewed literature is in 79 Danish dairy cows that were post-mortemed after dying on farm. Pneumonia and locomotor disorders were the most predominant proximate causes of death. So it's perhaps surprising there isn't more literature on this subject because it appears to be important. And from my perspective as a veterinary practitioner in southwest Scotland, pneumonia is a common clinical diagnosis. It's in the top 3. If we're called to examine a sick cow, the top 3 are abomasal conditions, metritis, and pneumonia. And speaking to colleagues in practice, particularly in northern Britain, they have a similar experience, that pneumonia is a common problem in dairy cows. And impressed upon that, in the UK in the last couple of years, there's been a discussion over outbreaks of pneumonia in dairy herds that are vaccinated against IBR. And some of these have been investigated in depth by pharmaceutical companies and have failed to demonstrate that IBR was the problem, but have also failed to demonstrate any other cause of the problem. So in light of this, I was interested in investigating cases that I saw in depth to see get more of an idea as to what was going on. And I was fortunate enough to be able to obtain a ruminant research bursary from MSD Animal Health to do this. So there was sufficient funding to investigate the etiology of the disease in 15 dairy cows. So the objective was to investigate the etiology of naturally occurring acute respiratory disease in 15 live dairy cows on different farms using standard laboratory techniques. And I should have mentioned earlier that the pneumonia that we see tends generally not to be large outbreaks, but sporadic cases or a series of a small number of cases that occur in a cluster. So the recruitment criteria for admitting cows to the study were designed to select acute cases where we would hope that the pathogen would be present and detectable, or would cause seroconversion. So there had to be dairy cows that had calved at least once, tachypneic, pyrexic, greater than 39 degrees C rectal temperature, a clear ocular or nasal discharge. Any purulent material might suggest that the case wasn't acute. Harsh lung sounds, plus or minus adventitious respiratory sounds, and no antibiotic treatment within the previous 7 days. The laboratory examination of these cases and the sample collection, unfortunately, was not consistent across the 15 cases due to 2 factors that were somewhat out of our control. First of all, the tubing for bronchoalveolar lavage sampling in adult cows became unavailable after case 8. Alternatives were tried, and in fact a number of cases were lost to the study where I was unable to obtain bronchoalveolar lavage with the replacement tubing. So there were no bronchoalveolar lavage samples collected after case 8. And also the SAC, who were doing the laboratory testing, replaced the indirect fluorescent antibody test for respiratory viruses with the polymerase chain reaction after case 4. So in summary, the bile samples were collected from cases 1 to 8, and these were examined for bovine respiratory syncytial virus and parainfluenza virus 3 by indirect fluorescent antibody test in cases 1 to 4 and PCR cases 5 to 8. And these were also cultured for bacteria and mycoplasma species. Nasopharyngeal swabs were collected from all cases, and for cases 1 to 4, these were examined for bovine herpes virus 1 by indirect fluorescent antibody test, and the remainder were tested for bovine herpes virus 1 by PCR. And for cases 9 to 15, additional swabs were collected, and these were examined for PCR for BRSV and PI3, and they're also cultured for bacteria and mycoplasma culture in the absence of a bile from these cases. Further laboratory examinations were examination of feces for lungworm larvae by Behrman technique and paired serology for bovine herpes virus 1, BRSV, PI3, Mycoplasma bovis, and BVD. And I would like to emphasize at this point that we were using standard laboratory tests that were routinely available for known bovine respiratory pathogens. And the laboratory work was carried out by SAC, Consulting Veterinary Services, which is a fully accredited laboratory delivering the disease surveillance in Scotland. And the laboratory, fortunately for us, was located fairly close to the practice area, so we were able to deliver. All the bile samples were delivered to the lab on the day of collection, and most of the nasopharyngeal swabs, some of the nasopharyngeal swabs were refrigerated overnight, but the bile samples were all delivered on the day of collection. This is case 3, having a bronchoalveolar lavage sample collected, and I can report that if you've got the right equipment, bile sampling of adult dairy cows is actually quite straightforward. It's provided you have good restraint of the cow and its neck extended with a very tight halter. It was usually quite well tolerated, and in fact the cow objected more to the nasopharyngeal swab than the bronchoalveolar lavage. The deep nasopharyngeal swab was more of an irritant to the cow than the bronchoalveolar lavage. And the tubing we used was the same as the calf tubing, but 1.5 times as long. And the problem with the replacement tubing was it jammed. The inner tube jammed in the outer tube and couldn't get it all the way into the respiratory tract. So what diagnostic criteria did we employ once the results became available? And the diagnostic criteria were demonstration of a pathogen in the bile or the nasopharyngeal swab by PCR test, or isolation of the virus, the bacteria, or the mycoplasma species, or detection of lungworm larvae in feces. So the IFAT results, if any were positive, were backed up or refuted by PCR test or virus isolation. Seroconversion on its own was not deemed a diagnosis, but would provide supportive evidence, provided there be no previous vaccination with the pathogen in question within 6 weeks of acute sample collection. So the key results: 15 cases from 10 different farms were sampled, and 12 of these 15 cases responded to treatment and survived. And the reason I mention that is because Colin Mason is presenting a series of post-mortem case findings for pneumonia in dairy cows, and of course they were all dead because they were post-mortems. This may be a different population of animals compared to his series. One case was euthanased before convalescent sampling, and at convalescent sampling 2 cases had responded poorly to treatment and were subsequently culled. And the interesting thing was that a diagnosis was made in only 2 of the 15 cases that were sampled. Mannheimia granulomatus, which was previously included in the Mannheimia hemolytica group. This was cultured from the bile from case 3, and Mannheimia hemolytica was cultured from the bile from case 6. And the latter, case 6, also seroconverted to BVD virus. And this case 6 was one of the ones that had responded poorly at convalescent treatment and was subsequently culled. 2 other cases seroconverted to BRSV in case 4, or bovine herpes virus 1 in case 14, but the viruses were not detected in the bile by IFAT in case 4, and in the nasopharyngeal swab by PCR in case 14. So the main conclusions from the study were, of interest was that no diagnosis was achieved in 13 of 15 cases where the criteria for studying the animal was that it should be an acute case where you'd expect the pathogen to be present or cause seroconversion. Furthermore, Trueperella pyogenes was not cultured from any case, and this is often associated with chronic pneumonia. So again, that supports the idea that we were selecting acute cases. So what are the possible reasons for no diagnosis? First of all, might have been the wrong clinical diagnosis, and this shouldn't be underestimated. The clinicians amongst us will be aware of the fallibility of basing a diagnosis on clinical signs. Perhaps the elevated respiratory rate was not, the signs of respiratory disease were not due to a respiratory pathology. Pyrexia in other body systems can cause tachypnea, as can pain. And I also learned on Monday that subclinical hypercalcemia can also cause an elevated respiratory rate. So there may be other reasons. There may have been some misdiagnosis. And I think in future, if investigation of live cows is carried out for respiratory disease, we should perhaps do a confirmatory test in addition to clinical findings to confirm that pneumonia is actually present. I'm not sure what that might be. Maybe there's a non-infectious etiology. Could this have been an allergic reaction, for example? Maybe our laboratory tests were insufficiently sensitive. We know they're not ideal, the sensitivity isn't ideal for young cattle, and maybe they're not sufficiently sensitive for pathogens that we know about. Or perhaps, lastly, the pneumonia may have been caused by pathogens unknown or not routinely tested for. Personally, at the moment, my feeling is that that latter probability is most likely, but I reserve the right to change my mind if any light of any future evidence. So in conclusion, further investigation of acute respiratory disease in dairy cows is required, because we're certainly not answering the questions as to what the cause of this apparently important problem is. Thank you for your attention.
Thank you very much, Mark. Do we have any questions, please? Yes, I can see.
Yes, Jansen from the University of Calgary. The 3 that died, what were the necropsy results?
There was no necropsies carried out. It would have been nice to do that, but under commercial farming conditions, it wasn't possible to capture the carcass to do a post-mortem, I'm afraid.
Nola Leonard, Dublin. I was wondering, was there any clinical pathology carried out on those BALs, like to look for inflammatory response or anything like that?
No, there wasn't, and I think that's probably an area that should be investigated in the future.
Any more questions? Yes, Owen again. Sorry.
Thanks. I really enjoyed that talk. It might be worth thinking about bovine herpes virus 4. You probably SAC are thinking about that anyway with those tests, but that's something that we've found in our laboratory in Ireland. Some samples do come up be bovine herpes virus 4 positive. And one of my colleagues has a poster on it, actually. I don't know, is he here? But it's something worth considering.
Right, okay, thank you for that input.
Okay, so I think it's time now. We thank you very much indeed. That was really excellent. Yeah.